All right. So before you mentioned diet and habits. So let's dig in a little bit more about that. What's your recommendations in terms of, we know sugar is terrible. It's just so hard in reality to avoid it
Course.
completely. But what do you recommend we do around that, or how do we make it better and optimize their tooth care?
Yeah, of course. So I think sugar is really hard to avoid. You never want to demonize a product. So I think there are a few things to be aware of. One, we typically think of candy and sodas as being bad for your teeth. We need to also consider simple carbohydrates such as crackers, pretzels. Think of things that get stuck in the grooves of your teeth because the longer they sit in your teeth, the higher the likelihood of cavities. Another thing to consider is frequency of snacking. So, if we're grazing through the day and constantly exposing our teeth to these sugars, simple carbohydrates, really anything besides water, it increases our risks of cavities. So, after a meal, I recommend just drinking plain water to help flush the teeth. And then another thing is milk or juice, liquids. I think that's the biggest thing because they have, even if it's natural sugars hidden there, they could sit on the teeth for long periods of time and make us susceptible to cavities.
And what can you help break down exactly what's happening with sugar in the teeth? I think that might help.
Definitely. So, what happens in our mouth once we eat sugar or these simple carbohydrates is our mouth gets into an acidic environment on the pH scale. And when our mouth is in an acidic environment, the bad bacteria that causes cavities can cause a cavity in the mouth. It essentially weakens the outer enamel layer of the tooth to the point where it could destruct and begin that decay process.
Are there some hidden forms of sugar that we might not be thinking of? I think milk is an important one that you said before, but anything else that maybe I'm not thinking about?
I think milk is a hugely important one because, especially between 0 and 12 months, where we're introducing nutrition, solid foods, and people aren't going to the dentist, they don't know that it's a source that can cause cavities. Whether that's formula, whether that's breast milk after food's introduced and it sits on the teeth specifically overnight, that's a huge, huge cause of cavities that we see as pediatric dentists. So, we highly recommend you don't sleep with a bottle of milk. If your baby likes a bottle for comfort, we recommend switching it to water after 6 months, so it flushes the mouth and cleans it rather than that constant exposure to the natural sugar.
So, whereas I totally understand this, I think as a mom and other people listening might think, well, I breastfeed to sleep, or I have the baby on a bottle to go to sleep. And this is all happening obviously before 6 months of age. So, how do we reconcile that?
I mean, this is one of those progress over perfection. You can't lose your mind over it because my baby was the same way. Like milk's comforting to them, they go to sleep with it. If your baby falls asleep with milk and they have teeth and you can't swing brushing or wiping the teeth in the middle of the night, which I have absolutely been there, your baby's asleep and you want to call that a win, try brushing first thing in the morning and just, consider it, but don't drive yourself crazy.
Great advice. Are there things in the diet that you do recommend that would help the health of our mouths and teeth?
Yeah, I think just being smart or thoughtful about what we're snacking on, ideally. It's a little bit harder if we're on the go. So, obviously, things like Cheerios, pretzels, crackers are really easy and, they won't spoil. But those are the things that could get stuck in the teeth. But some options are cheeses, like meat sticks, nuts, seaweed snacks, things like that are great for the teeth and good options. Same with yogurt as well. We just want to be considerate about, again, about what breaks down to a sugar because that could damage the teeth, but also don't drive yourself crazy.
Are there any like supplements I've been asked that you recommend?
Not necessarily. People say magnesium, calcium, but I think there's not enough strong data to outweigh the other things that we could control, such as diet, nutrition, behavior, and habits.